Today in series of Docplexus Care interviews, we have with us Dr. Desmond Schatz. He's an Associate Chairman of Pediatrics, Medical Director of the Diabetes Center, and Associate Director of the GCRC at the University of Florida. His research is focused on preventing and reversing type 1 diabetes as well as management of type 1 diabetes in children. Thank you for the interview.
Thank you very much for the invitation. It's a pleasure to be here.
Yeah, so let's begin with the first question. Doctor, kindly elaborate on the key immune interventions and mechanistic studies of type 1 diabetes management.
Studies seeking to intervene or prevent type 1 diabetes have really been divided into both intervention as well as prevention studies. Intervention studies seek to firstly preserve the ability of the beta cells to make insulin. In addition to that, we seek to find mechanisms that we can use to earlier in the disease to actually prevent type 1 diabetes. Type 1 diabetes prevention can be divided into stages. Primary prevention, which is really the prevention of autoantibodies and autoimmunity, and secondary prevention, which is the development of diabetes subsequent to the development of autoantibodies. And once we learn from studies in new onset and established cases, we can apply those studies to the prevention of the disease. Actually, to date, we've not been successful in preventing type 1 diabetes.
So, Doctor, moving on to the next question. According to you, what are the key challenges in the management of pediatric or adolescent patients with type 1 diabetes?
So, type 1 diabetes is a burdensome disease, and we need to recognize that. It is a burden to the child, it is a burden to the family, it has emotional consequences, it has financial consequences. And so we need to understand that. When I see a patient with type 1 diabetes, I typically spend nearly an hour with that patient, with that family, trying to understand. Because if I can get them to understand, to buy in, I know that they're going to do better. So I think that one of the challenges is time, and I also believe in empowerment. If you can empower the family, and if you can empower the child to make decisions, it is more likely that he or she is going to be under better care, which will obviously reduce short-term and long-term complications.
Right. So, Doctor, moving on to the next one. You're a part of various clinical trials that are related to type 1 diabetes management. So, can you please elaborate a few?
Certainly. I have been part since the early 90s in the Diabetes Prevention Trial Network as well as TrialNet. And we have conducted studies at various stages of the disease in order to prevent the disease. So we have embarked on oral antigen therapy, more specific therapy, to try and intervene in the disease and prevent the disease. And to date, we have not been successful. We have also done studies in new onset cases and established cases as part of TrialNet, as part of the DPT, and really independent studies of our own in connection with the National Institute of Health and the Juvenile Diabetes Research Foundation. And what we have found is that there are some agents that will preserve the ability of the beta cell to make insulin, but unfortunately that preservation is not sustained.
Right. So clinical recommendations suggest monitoring of ketones for patients with diabetic ketoacidosis, which is an acute but preventable complication of type 1 diabetes. Can you please elaborate on the levels of patient adherence in this disease?
Great question that you've just posed, because as I mentioned earlier, it is a burdensome disease, and key is education. Education of the patient, education of the family, to understand that during times of stress, during times of illness, or insulin non-administration, ketones are going to develop. Ketones means an inadequacy of insulin, so you have to take additional insulin. So when patients check for ketones, which can be done either through the urine or via the blood, it is imperative that they take additional insulin. And we give instructions and we teach the family how to do this. The best, what we do is we instruct families to call us so that we can give additional fluids, because ketones leads to dehydration. And additional fluids plus the supplemental administration of insulin can prevent unnecessary hospitalizations which carry morbidity and indeed mortality.
Okay. Thank you so much for the interview. It was a pleasure having you here.
It's a pleasure being here, and I think, you know, it's a great conference, and the Chalaram Diabetes Institute should be congratulated on a spectacular meeting.
Right.
Thank
you
you
so much.
Thank you.